Most people think fatty liver is harmless, but if you ignore it, it can turn into cirrhosis or even liver failure. Fatty liver is reversible, and today, I'll show you the fastest and safest way to fix it. On this channel, I discuss common health concerns using the latest medical research, so you can make smarter, healthier choices. Subscribe to this channel for more health-related videos. Let's discuss today's topic. Fatty liver happens when too much fat builds up inside your liver cells. This usually happens because of poor diet, obesity, lack of exercise, or high sugar intake. Even if you don't drink alcohol. Here are 5 proven methods that help reverse your fatty liver fast. The number 1 fastest method? Losing 5 to 10% of your weight.
The fastest proven way to reverse fatty liver is losing 5 to 10% of your body weight.
Even a 5% weight loss can reduce liver fat. A 10% weight loss can reverse inflammation and early liver damage. Number 2, cut sugar immediately. When you eat too much sugar, your liver turns it into fat. To improve your health, let's stop or reduce soda, juice, candy, white bread, and fast food. Many patients see improvement in just 2 to 4 weeks. Number 3, do exercise for liver recovery. You don't need intense workouts, just 30 to 45 minutes of walking, cycling, or home exercise. If you can your 5 days a week, can burn liver fat and improve liver function. No alcohol. No alcohol means faster healing. Leafy greens, garlic, oats, walnuts, berries, olive oil, and black coffee, 1 to 2 cups a day. These foods help your liver detoxify and heal. With strict lifestyle changes, 2-4 weeks, fat starts reducing. 8-12 weeks, major improvement. 3-6 months, many people reverse fatty liver completely. It can turn into NASH, fibrosis, and cirrhosis. But if you act early, your liver can fully recover. Your liver works 24/7 to detoxify your body. Protect it with the right habits. If you like this video, subscribe for more health tips and take care of your liver. I will see you in the next video. Stay healthy. Goodbye.